Well, I want to talk about incontinence a little bit
Okay.
because I think it's something that gets mentioned in physical therapy school and it's kind of
Mhm.
talked about very superficially in terms of like, oh, like maybe it's like an intra-abdominal pressure issue or there's like some pelvic floor weakness. So I'm kind of
Right.
curious your thoughts in terms of, well, one, what would could cause incontinence, and then does the threshold at which the pressure intensity buildup occurs basically, or like what's the threshold for how much pressure someone can take before they may like leak or something? Like how does that play into how you're going to approach treating someone with incontinence?
Well, first I have to figure out why they have incontinence. So, okay. So, someone can have incontinence because they have a weak pelvic floor. And so that's what you're talking about, the pressure buildup. So the the amount of pressure you'll be able to manage is all based on the strength of the system, that like pressure system. So your pelvic floor, your abdominal wall, your diaphragm. So, when you have a really strong core system, of the and that's lined up well. So, you can have you can power lift like a female, and understand like a female's pelvic floor is so like the hole that has to be covered by muscles is so much bigger, right? So that's why it's such a female issue usually. But if you have a power lifter that has or an Olympic lifter that has a really solid, strong pelvic floor, fairly lined up diaphragm over your pelvic floor, because those things work together. And I can explain that more if you want. And then a strong abdominal wall, well, they can handle all sorts of weight and push their belly out with a belt on, adding more pressure to the system, and be fine and not leak. Let's just say you're 65, you've had 4 kids, and your organs are fallen down. So your uterus is no longer suspended anymore by ligaments; it's lying down on your pelvic floor. So that's extra weight. Maybe you're also constipated. You know, um, now you have a ton of pressure on your pelvic floor, and your pelvic floor is weak. So someone like that, it's not going to take much to be able to leak urine, right? They're going to be pretty quick to leak. Um, I've seen women that have had maybe they just have one of those, like they have the prolapse, um, or they don't. Let's just say they don't even have a prolapse. Um, they say, "Oh, I leak a little bit with jumping and stuff like that." They might actually not have a pelvic floor strength problem. They have a positioning problem, and so you can strengthen and strengthen the pelvic floor, and then what's going to happen is you're going to give them pelvic pain because you've had them do Kegels, and that's not what you need to have them do. So with those people, I have to work a lot on position. Okay, so that would be a different situation. There's people that post delivery, they lose a little bit of the innervation, or it's at least like damaged a little bit, and they might have actual pelvic floor weakness. So I would address that different, right? So that might be something I address with Kegels directly. Um, so I have people that um, just don't know how to activate their pelvic floor. So maybe they had a baby after everything got stretched out, and they just need some cueing. So they just need me to go in there and say, "Oh, this is how to do it. This is how to do it properly," and then they get it, and we do pretty well. So there's so many things, and that's what I get a little irritated. I'm not gonna lie, get a little irritated of all the pelvic floor experts now, that have never actually felt pelvic floor muscles and understand that there's a million problems. Some people have actual like a hyper they have too much irritation around their bladder, so they feel like they have to go to the bathroom a lot. um, and their pelvic floors are usually kind of tight. And so you give someone like that Kegels or any kind of pelvic floor work, because you're assuming that they have a weak pelvic floor. So then that's where your training goes. And I don't care if you're doing Kegels or squats, if they have bladder irritation, then that needs to be addressed. Some people, these are the fun ones because I fix them really fast. It's like a poor brain bladder connection. And so they have these places that actually trigger their bladder. So when they're going home and they're going to let themselves in the door, their brain has started like developing a really strong connection between like going to the bathroom and going home. And so their bladder will just contract right there. And because they've never had to think about it, they don't think about contracting or changing that pattern. So these are the people that I'm like, when you go inside, you have to, and I make them do it right in the clinic. I'll say, what's an activity you can do before you go pee, before you go to the bathroom, when you get home, and they'll tell I'll let out the dog, or I'll look through the mail, whatever, and then they come back and they're like, I can't believe that worked, but it worked, because you're taking away that quick connection between the brain and the bladder of I'm home, I need to pee. And our brains are efficient; they're amazingly efficient. It's the reason that if you always get up and go to work at 7 a.m, you get in your car at 7 a.m, Monday through Friday, and you happen to have to get in your car on Saturday to go to work or to go somewhere at 7 a.m. If you're not on it, you're going to drive to work, right? Because our brains are efficient and they create these patterns. And so sometimes just breaking the pattern is enough to stop incontinence. So there's a bazillion answers to solving incontinence, but you have to understand the connection between the brain, the bladder, and the pelvic floor. So when you contract your pelvic floor, you automatically, there's a quick nerve connection between the pelvic floor and the bladder. So if you can properly contract your pelvic floor, you actually send a message to the bladder to relax. Okay. And then there's a connection between the brain and the bladder. And that's what I'm talking about, like those combinations that are those things, those situations that we make ourselves, that one thing equals peeing. And so then you'll just pee. If you don't have the pelvic floor in there to stop that connection, then you're going to then you have a problem. So it's very, there's so many levels to it, and you have to understand all of them. You also have to understand things that might, like food and drink irritations that affect the bladder. Also, people who aren't really careful at watching what the abdominal wall is doing. So I can feel someone Kegel. Let's just say I'm doing an internal exam and I ask someone to Kegel, and I feel that their muscles are working, and it's someone who complains about leaking. And my younger self would have said, oh, they shouldn't leak. They're strong. Their pelvic floor is strong. Why are they leaking? But then as I watch a little closer, as I've learned, as they're contracting their pelvic floor just a little bit, they're protruding their abdomen, and it's hard to catch. It's very small. And so you have to watch that. And so there'll be this tiny baby protrusion of the abdomen, which helps me. And if they're just doing that for a little pelvic floor, imagine what they're doing to lift up a box, right? Just so then I start cueing them I start working on at that point, I stop doing anything with the pelvic floor, and I start working with how they're contracting their abs for doing anything. And it fixes itself up. So there's so many things, but you have to understand the whole system. You have to understand what urination is from a neurological standpoint, from an organ standpoint, from a pressure standpoint, and from a bladder, or from a pelvic floor standpoint. And constipation causes people to have incontinence.
You worry me.
I know. Well, it's all I talk about it all day.
Wow.
So yeah, that's my 2 cents on why people shouldn't be just throwing out on the old interwebs about how, about their thoughts on treating pelvic floor.